Good morning. No, you cannot hear me now. I don't know. Can you hear me? Yeah, it's working. Perfect. Okay. Good morning, everyone. My name is Elena Milivinti. I'm a second-year PhD student here at UB, and today I'm, let's say, following the flow of Bill Duncan's presentation about the work that we have been doing on the ontology of dental care related fear and anxiety. Yes. So as Bill has been presenting before me, we have been working on building an ontological framework to create an ontology for representing dental care related fear and anxiety. From now on, I will use this color scheme because one of the main goals was trying to distinguish these terms, because in the literature right now, they go under the umbrella of the common term dental fear and anxiety. So we based our research on behavioral, physiological, cognitive, and temporal dimensions. And here you can see which DFA studies we have been using. So the CORA studies, the ADA oral health and well-being studies, and the Black women's health study. And part of the work was going through the assessment instruments. Here I reported 3 of the assessment instruments that we have been using. So the dental fear survey, the modified dental anxiety scale, and the index of dental anxiety and fear. Now I will spend some time for going through one of the survey we have been working on. This is actually the full modified dental anxiety scale. And when we have been working on the question that usually the patient receive when they're trying to assess if the patient is affected by dental fear and anxiety, we see that, for example, the first question, I call it the tomorrow question. If you went to your dentist for treatment tomorrow, how would you feel? Second question, if you were sitting in the waiting room, how would you feel? And the third question, if you were about to have a tooth drilled, and so on. So there is like, we decided to go for dividing the question in 2 main categories. Some of the questions have this anticipatory dimension. So for example, saying tomorrow or be in the waiting room, while some other questions had more a specific dimension of the procedure that the patient would be going to, like having a tooth drilled, having a teeth scaled. So as Bill mentioned before, that anxiety and fear have different dimensions. So anxiety is more anticipatory, while fear it's more stimulus related. It's related to a threat that it's present in the very moment. This is a bit the work that we've been doing. So like mapping some question in more an anxiety dimension, mapping some other question in more a fear dimension. This is another survey. This is a much more complex survey. So here I'm just presenting part of it as I think it's it's like relevant for the presentation. So this is the index of dental anxiety and fear. It's a multidimensional assessment, so it takes into account cognitive, physiological, and behavioral domains, and also has many physiological responses. So also part of these questions were about the anticipatory dimension, and some of them were more about the stimulus or fear dimension. Building on this service, we decided to map the different questions which were involving different stimuli into like these six main stimulus categories. So instrument, auditory, visual, tactile, olfactory, and environmental. So on the let's say on the right part or the left part of the slide, well, we mapped the different survey question, let's say. So we have the instrument question, for example, when a survey was asking about needles or injections, or auditory when hearing the drill. We did this because the dental environment is very rich of different stimuli. So maybe as a patient, I'm triggered by the sound of the drill, but maybe some other patient is triggered by just seeing a certain instrument. So one of the main goals, one of the things that I've been interested in working on was trying to differentiate dental care related fear from dental care related anxiety. And these are the definitions that right now we have. So like dental care related fear is a fear triggered by stimuli in the immediate dental care environment, and includes behavioral responses such as physiological responses as muscle tension and increased heart rate. While anxiety, or dental care related anxiety, is anxiety experienced in relation to future dental encounter, characterized by cognitive responses as worry. So we have this, we adopted this temporal framework. One is anxiety is more anticipatory, while fear is more stimulus related. And this is the pattern that we've been working on that relates dental care related anxiety and dental care related fears. So we have at the bottom muscle contraction, which is a dental care related physiological arousal, which is a physiological arousal. So this part of the graph, it's more about the proximal physiological response, while the other part is more about the distal avoidance behavior. This is to show how the two dimensions, they coexist, but it's also useful for the clinicians to work on different dimensions of the dental care related fear and anxiety. Also, what we have been doing, it was mapping the journey. So as we have been saying, like we have this temporal dimension. So we decided to map different parts of the process of the dental encounter. So we have the before part, which involves pre-appointment anxiety, anticipatory concerns, and then during the dental encounter itself, like the waiting room experiences, the examination and procedure, and immediate physiological response. After dental encounter, which is what we are actually working on, because it's not really been like in the dental fear surveys, in the dental fear anxiety survey, it's still something that it's not really have been explored. So like the post-treatment recoveries, the lingering anxiety, or the worries that the patient might have after the dental encounter. So let's say that these are the three main dimensions, but the after the dental encounter, it's what we are interested in working on right now. And this is an example. And I think it's important to understand why the post-visit is important, because based on many papers that we've been working on, it seems that negative dental experiences are one of the main reasons why patients have dental care-related fear and anxiety. So Sarah, our patient, 6 months ago had a traumatic root canal experience. And the fear manifestation during the treatment was muscle tension, perspiration upon entering the office. And then in the future, when she comes home and she's like thinking about future dental events, she's actually deciding for postponing maybe just a cleaning appointment because she doesn't want to experience the same problems anymore. So like we have this distinction, and it's important to focus also on the post-visit worries, maybe with some surveys that the patient received maybe 24 hours after the dental visit. So the main achievement is that we created an ontological model to distinguish dental care-related fear and anxiety. We integrated the multi-survey data in a unified framework. And I think this will be important in the future to have a personalized interventions. So for example, if a patient is triggered by a certain noise in the dental encounter, might be useful to use calming music or some earplugs to avoid this kind of trigger for the patient. On the other hand, if the patient is experiencing anxiety, it's important to diagnose, and it's important also for the patient to actually make it to the dental encounter instead postponing it and then ending up with a much worse dental procedure. And these are some QR codes, the project website, the GitHub, and the bioportal. So thank you, everyone.